CPT JJ-CPV Introduction, page 12, part 14.
Selection of procedure.
Continue, right? This is continuous from the previous parts, right?
Yes.
The placement of a given service in a specific section of the book may reflect historical or other considerations, which means that because it's always been placed in certain part, it stays in that part. That means historically, or there are other considerations. For example, the placement of the percutaneous peripheral vascular endovascular interventions in the surgery cardiovascular system section, in this one, right, in this section, while the percutaneous coronary interventions appear in the medicine cardiovascular section. You would think that they would appear in the same section because they're similar. But no, but historically they were put in a different place. That's why they stay there. That's our theory for today, okay? Now we're gonna do our problem. So ready, set, go. Okay, this is CPT JJ-RVA, page 268, exercise 141, and it's a level 1 exercise, and it reads like this.
Surgery, eye and ocular ADNEXA.
Mm-hmm.
Aphakia, penetrating corneal transplant.
Right, aphakia penetrating corneal transplant, right? So the whole problem is the surgery section of the CPT code book is the eye and ocular ADNEXA, that's the body part, and it's an aphakia penetrating corneal transplant, okay? So we're going to count to 3, so you can pause the video and give us the CPT code for this procedure. These are procedures, so we need the CPT code for the procedure, okay? So 1, 2, 3. Okay, the answer is 65,750. Okay, if you got that, congratulations. You can go to the next video. If you didn't get it, let's give you a couple of tips. Okay, first tip.
Start with transplantation cornea.
Start with transplantation and then follow it with cornea, right? Now, the second tip.
Autograft, homograph is valid for all cornea transplantations. So just ignore it.
Right. After you go to cornea transplantations, all of them are autograft or homograph. So that particular words, you just ignore it because all of them are going to follow that. And the last one is?
You don't find aphakia in the index, but you will find it in the tabular.
Right. You're looking for aphakia in the index and you don't find it. But don't worry. You just go to the tabular. In the tabular, there is one item that has aphakia in it, okay? So those are our tips. So now with these tips, you should be able to get the answer. The answer is, or the path to the answer. The answer is 65,750, but we need you to find the path now, how you got to the answer, okay? So we're going to count to 3, so you can pause the video and give us the path to the answer. 1, 2, 3. All right, the summary of the problem. This is the surgery section of the CPT code, is the body part eye and ocular ADNEXA, and it's an aphakia penetrating corneal transplant. There's only one code, and this code 1 through the index is found like this.
First, you go to index.
Start with the index, and then
transplantation.
Go to transplantation and
cornea,
autograft, homograph, right?
Autograft, homograph.
They are all autograft, homograph. This forward slash is not a forward slash, but it's the forward slash from the book, right?
Yes.
That doesn't mean go to, but in the book they have a forward slash. Okay, now this is our forward slash, means go to penetrating, because it says penetrating in the text, right?
Right.
So you get a range, right? Yeah? A range of values from
65,730
through
65,755.
So you're going to analyze all of them, right?
Yes.
So we go to the tabular, and the code 1 through the tabular is found like this.
65,730.
Right, you go to the tabular and you start with the first one, right?
Oh, right. You first go to the tabular.
Go to a tabular and then you start with the first value, right?
Yes.
And what is the first value?
Keratoplasty, penetrating, except in aphakia or pseudophakia.
Okay, so this says a penetrating is fine, but it's except in aphakia. So this is not valid for us because we need aphakia. So keep going, and the next one is what?
65750.
And there you find
In aphakia.
in aphakia. And if you keep looking, there's another one that says in pseudophakia, right?
Yes.
Right. But we need in aphakia, so we go back. Put here go back, which is the double.
That's right.
The double forward slash. The double forward slash means go back. Go back to the one of the codes that you have reviewed already, and this code is 65750, the one that said in aphakia, which is our answer, right?
Right.
So our answer is 65750, and that's why there's an equal sign there, right? That confirms that that's our answer, 65750, okay? So thanks for watching, and then please visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
Right, just click in the red rectangle, and what do you get?
You get up to 3 videos every day that we make. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Right, okay, so don't forget, just visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.